she wouldn't have to see any doctor. She'd have immediate access at any moment in time, at any location, to a diagnosis of her medical condition. She would not only avoid the delay, inconvenience, and unnecessary expense, but she wouldn't even have to find someone to steal her chart. The difference between these two scenarios represents the essence of a new era of medicine. It is powered by unplugged digitization, with the smartphone as the hub. We have seen this model already adopted in retail, travel, dining, entertainment, banking, and virtually every other industry. It's all on demand and instantaneously executed. This has moved far beyond just having a prosthetic brain for a search or a built-in navigation GPS. In almost any endeavor, getting things done in a flash has become the norm, except in medicine. But that is now inevitable. Getting first-rate healthcare will always be quite different from ordering something from Amazon. We're talking about the most precious part of life, one's health, not buying a book. But the common thread is the power of information and individualization. We are embarking on a time when each individual will have all their own medical data and the computing power to process it in the context of their own world. There will be comprehensive medical information about a person that is eminently accessible, analyzable, and transferable. This will set up a tectonic, or tech-tonic, power shift, putting the individual at center stage. No longer will MD stand for medical deity. What have been dubbed the 6 most powerful words of the English language, "the doctor will see you now," will no longer be true. Indeed, you will still be seeing doctors, but the relationship will be radically altered. The doctor will see you now via your smartphone screen, without an hour of waiting, at any time, day or night. It might not be your primary care doctor, but it will likely be a reputable physician who is conducting part of his or her practice through secure video consults. And those consults will involve doing parts of the standard physical examination remotely. More importantly, they will incorporate sharing your data, the full gamut from sensors, images, labs, and genomic sequence, well beyond an electronic medical record. We're talking about lots of terabytes of data about you, which will someday accumulate from the womb to tomb in your personal cloud, stored and ready for ferreting out the signals from the noise, even to prevent an illness before it happens. The power shift. More is at play than just your little big data. Let's drill down on the term democratization, meaning to make something available to all people. Until now, the flow of medical data has been to the doctor. If a patient was fortunate enough, their data, such as results of lab tests or scans, might arrive in the mail. More likely, but still rare, would be for the bottom line, like everything is normal, to be relayed via a phone call, often via a nurse or office assistant. The really lucky patient, with a less than 1 out of 10 chance in the United States, might even get an email with attachments that include all their data. But the world is changing now. Patients are generating their own data on their own devices. Already, any individual can take unlimited blood pressures or blood glucose measurements, or even do an electrocardiogram, ECG, via their smartphone. The data are immediately analyzed, graphed, displayed on the screen, updated with new measurements, stored and, at the discretion of the individual, shared. The first time I had an ECG emailed to me by a patient with the subject line, "I'm an atrial fib, now what do I do?" I knew the world had changed. The patient's phone hadn't just recorded the data, it had interpreted it. A smart algorithm was now trumping one of my skills as a cardiologist. Putting this power in everyone's pocket could preempt an emergency room visit or an urgent clinic appointment. In our unplugged world full of mobile devices, a diagnosis could now be made anywhere, anytime, by anybody. Or by a machine. 3 other experiences over the past couple of years attending to airplane passengers in distress have reinforced my sense that medicine has already transformed. The first, passenger.